A wave of outrage and frustration is sweeping across Australia, fueled by the Queensland government's controversial decision to temporarily halt access to essential healthcare for transgender minors. This decision, announced last week, sparked a nationwide outcry, culminating in a series of powerful rallies across the country on Saturday. Thousands of people, demonstrating unwavering solidarity with transgender youth and their families, converged on major cities, their voices echoing a demand for immediate action. The scale of the protests was truly remarkable. 20 rallies were held across Australia, with a staggering 5,000 participants gathering in both Brisbane and Melbourne, a significant showing of 500 in Sydney and over 200 in Cairns, according to lead organizer Jackie Turner, also the director of the Trans Justice Project. The sheer number of attendees underscores the depth of public concern and the widespread support for the transgender community. Today's turnout of thousands demonstrates that Australians stand firmly with the transgender community, advocating for accessible and affordable gender-affirming care for all those who need it, Turner declared, her words carrying the weight of collective determination. The rallies served as a potent visual representation of the community's unified stance against the government's decision. The message was clear. The Queensland government must immediately reinstate healthcare access for transgender youth. The Queensland Liberal National Government's decision to pause new patient access, under 18, to gender-affirming care, including puberty blockers and hormone therapies, within the state's public health system has ignited a firestorm of criticism. The stated rationale for the pause is a government review of the evidence supporting stage 1 and 2 hormone therapies for children with gender dysphoria. However, this explanation has been met with staunch opposition from prominent medical organizations. Peak medical bodies, including the Royal Australian and New Zealand College of Psychiatrists and the Australian Medical Association Queensland, have unequivocally condemned the ban, highlighting its devastating impact on evidence-based healthcare for 491 young people and their families. The decision represents a significant setback for transgender youth, hindering their access to crucial medical interventions that align with established best practices. The human cost of this policy is deeply felt by families, as evidenced by the poignant testimony of Brisbane mother, who preferred to withhold her last name. She shared the immense stress her family has endured since the policy change. Her 15-year-old child, who has been receiving puberty blockers for 4 years and was on the verge of starting hormone replacement therapy, HRT, now faces an uncertain future. "Now that can't happen," said. Like all teenagers, she just wants to look like her friends at school and express who she really is. Her words encapsulate the emotional toll this policy is taking on families, leaving children feeling isolated and the opportunity to express their true selves. Turner voiced her fervent opposition to the government's actions, asserting that governments cannot arbitrarily ban evidence-based healthcare based solely on their political ideologies. "A lot of parents are feeling really angry and frustrated with the government," she stated, reflecting the widespread sentiment among those affected by this decision. The rallies represent more than just a protest. They are a powerful demonstration of resilience and a commitment to continued advocacy. Turner emphasized the campaign's ongoing efforts to pressure MPs nationwide to champion the rights of transgender individuals. "What I hope trans youth take away from this day is that you are not alone, and we've got your backs," she concluded, offering a message of hope and support to those most directly affected. The fight for access to vital health care for transgender youth continues, fueled by the unwavering determination of a community united in its demand for justice, equality, and freedom. The rallies serve as a stark reminder of the urgent need for compassionate and evidence-based policies that protect the well-being of all children, regardless of their gender identity. The government's decision has ignited a national conversation, raising fundamental questions about healthcare access, political interference in medical decisions, and the rights of vulnerable members of society. The outpouring of public support for transgender youth demonstrates the deep-seated belief in inclusivity and the unwavering commitment to ensuring that all individuals have the opportunity to thrive and live authentically.